Hi, it's Doug Holland, LMT, with another massage tip for massage professionals. Today we're going to be discussing Dequervain's Tenosynovitis. Try to say that 5 times fast. So what is Dequervain's Tenosynovitis? Well, it is an inflammation of the sheath, that is the sheath that surrounds the tendons themselves. They pass through a tunnel, right? They pass through a tunnel. And that allows them to slide back and forth up to the bones without coming in contact with the bones itself so that they're damaged. And in that sheath that they go in and out of, there's a fluid, a grease, so to speak, that allows them to slide very, very comfortably. However, with overuse, people that maybe hairstylists, they're always squeezing on scissors, or people that do a lot of texting, or golfers that swing into abduction constantly, people that use a computer mouse that has that little ball, even some guitar players that are constantly moving their thumb up and down, they find a lot of pain starts to develop in this area. Those tendons get thicker and thicker from the overuse. And then all of a sudden that sleeve that allows for that passageway of those tendons, it can't do it anymore. It can't expand anymore. So it becomes like a stiff tunnel. Those tendons now can't pass through. And then the sheath that's around there becomes inflamed. And then the pain sets in. The person will also lose range of motion. It'll become so painful they can't even hold on to a pencil sometimes. Some people are actually have to get out of their employment because of that particular situation. So how do we know if we actually have this DQT syndrome? How do we know? Well, there's a test called the Finkelstein Test. And what you do is you take your thumb and you put it inside your hand like this and wrap your fingers around so you can't see your thumb at all. And then you simply ulnar deviate the hand. And what that means is you push your fingers down like that. Let me see if I can do that from the side. You push your fingers down like that. And these tendons now are being stretched to the maximum. And you will feel, this will be almost impossible with somebody that has DQT. Almost impossible what I'm doing right here. If you don't feel pain when you're doing this, then you don't have, that's not your issue. So what we're going to do is we're going to discuss where these muscles are, their origins and insertions, and then we're going to get into how we can address these, or at least the way I like to address these particular tendons and muscles to bring relief to this condition. Okay, so before we get into the massage techniques that I like to use, I think it's good that we identify where the two muscles and the tendons originate and insert. So first, let's start with the abductor, that's abductor pollicis longus. Now, we know that it originates on the posterior surface of the ulna, the radius, and their interosseous membrane, which is the connective tissue between the two bones. Then what we do is, that's the origin, then what we do is we draw a line to where it inserts, which is the first metacarpal base. Just like that. So that's abductor pollicis longus, right? Now, the other muscle that we're concerned with is the extensor pollicis brevis. It also originates on the posterior part of the radius bone and also the interosseous membrane. It does not go all the way to the ulna though. So interosseous membrane, radius, and then we draw a line. It goes further. It inserts on the base of the proximal phalanx of the thumb. So this one is a little bit longer in its tendon length, but both of these tendons pass underneath and between this soft tissue right here. So it's kind of like walking the ridge. If you look at it where the styloid process of the radius is, you just walk that ridge, that's where these two tendons come in. And again, they're designed to do two things. The extensor pollicis brevis pushes the thumb this way, and the abductor pollicis longus lifts the thumb up this way, which is abduction. So we call it the hitchhiking muscle because if you remember in the old days when we used to hitchhike, well, you had to get that thumb up nice and high. So that's where those two muscles are. Now we're going to get into how we work this area. Taking in consideration the individual is going to have pain. Remember how we did the Finkelstein test? We put the thumb in there, wrap the fingers around, and then ulnar deviate the hand. And that's what I'll do when I'm testing on my patients. If they have Dequervain's Tenosynovitis, I just go ahead and I push down. So I'm using the bridge of my hand to push down and extend these tendons here to see if there's any pain. And of course, if there's any pain right in here, they're immediately going to feel it. So what I like to do first is I like to work the webbing of the thumb on the posterior surface, and I take my thumb and I get in between the thumb and the index finger, right in between, and work that webbing all the way until I get onto the most lateral part from the midline of the hand itself. So now I'd be right, and if somebody had this problem, they're going to be feeling it right there too. That's going to hurt them. But this walking motion with my thumb is actually pushing the tendons back towards their origin, just like that. I generally only work from the most distal aspect to the proximal aspect when I'm doing this motion. Now I'll switch to a transverse process, which is cross fiber friction over those tendons, and I will walk the thumb this way. And you can go from lateral to medial. You can go from medial to lateral. It's whatever you decide you want to do. I cross it both ways. And again, if somebody has this issue, that's going to be painful. But if they want to feel better, we got to work all the soft tissue in the area. I'll also extend the thumb, like pulling the thumb like a prank. Hey, pull my thumb or my finger. We're going to pull on that. And you can see how that's stretching the tendons right there. And then I'll take my other thumb and I'll place it right over the carpals themselves. I will squeeze down, and then I will circumduct the pollicis, which is a fancy name for the thumb. As I'm circumducting it, this tissue in here is striking my thumb. And it's also causing those tendons to stretch and to loosen, just like that. I will also take my index finger and I'll hook underneath very quickly, and I'll work the Thenar eminence. This is the Thenar eminence of the thumb itself. It's that fat pad right there. I will take my fingers and I will rapidly move through that tissue just like this as I'm pulling the thumb. So I'm pulling the thumb, I'm pulling it, and I'm digging into that soft tissue. All of this is designed to help bring relief and to train these nerves to quit being so inflammatory, allow some cellular nutrition to make it to spots that might not quite be making it because of all the inflammation. Another thing I like to do is to plantar flex the wrist, and the way I do that is I take my thumb, I put it across the top of the metacarpal heads, and I put one thumb over the top of the other. So I got a firm hold of those metacarpal heads, and then I plantar flex until I see the brachial radialis, which is the forearm muscle, get very, very tight. And I can see it in flexion right now. And then I just do the reverse. I take my hands and I cup over the top of the hands, and I drive both of my fifth digits down deep into the wrist itself, and then I plantar flex, or excuse me, dorsiflex the hands. So a real good dorsiflexion. And obviously I can't see the forearm muscles from underneath when I'm doing this. I just have to go by how much tension and stress that I'm feeling. because what you're doing is you're really bringing a lot of stretching to the ligaments and tendons of the wrist here, especially right underneath this retinaculum that pins down these tendons. You can also put your fingers between theirs, and you can stretch this way. You can lift and stretch, which again is dorsiflexion of the wrist. You can see I'm exposing all that soft tissue there. And then I can take my thumb and I can walk the Thenar eminence this way. I'm driving and hooking into that pad. And I'll tell you, when you get right deep inside here, you'll find a lot of inflammation and pain. And most people that have this particular DQT situation. So just another thing that I like to do is you can laterally rotate the wrist. So I'm pinning just above on the proximal side of the carpal bones, and I take this thumb and I'm pinning that Thenar eminence, and I'm actually forcing the thumb away from the body. So I'm heading in that direction there, in that direction, away from the body, which is external rotation. And then I will medially rotate the wrist and do the exact same thing without moving my left hand. I still have it pinned, and I'm just reaching around and I'm grabbing and I'm twisting the wrist this way. So what I'm trying to do is stretch all these tendons and ligaments on the extensors as well as the flexors in a way that they might not be stretching. And another thing too is I can use like an orbital movement with all these flat bones in the wrist, all the square bones. And that also brings fresh circulation and healthy nerve innervation to these nerves, muscles, tendons, and ligaments. Okay, so that's about it. You can work your way up into the flexors themselves. You can get a little bit deeper into these muscles. They're a little deeper, the ones that actually abduct and extend this thumb. But if you press hard enough in there and you work that soft tissue, you should bring quite a bit of relief to the DQT that we see on a regular basis here. And we haven't seen it fail yet. I think maybe one person still went for the cortisone shots, but most people get plenty of relief. Well, I hope you enjoyed this massage tip for massage professionals. If you did enjoy it, please hit like and subscribe. You can also go to our website at hollandreflexology.com, where we have the articles that actually support this video. And just remember this: if there's no discomfort in the treatment, well, it's probably nothing more than a foo-foo massage.